both of us enjoy this topic.
We do. Absolutely. Absolutely. But enjoy it for all the wrong reasons.
Why did you say that?
Well, I think we enjoy it because we don't agree with the general norm, or at least we thought we didn't until we looked into it a little bit more.
That's true. Yeah, I agree. And then I think on top of that, it's I think we're kind of pigeonholing ourselves a little bit in that we're saying that there's a norm, which there isn't really. We're just kind of acting like the victim.
Yeah.
And the second thing being that, yeah, we actually don't necessarily disagree with it. I'd say we're pretty weight inclusive overall, really. Do you agree?
Yeah, pretty much. I think let's put our positions back. Let's rewind to our uni days when we became aware of this type of thing. So for a little bit of context for the people who are listening at the moment, when we was a second year, third year uni, something along those lines, we were kind of brought to the attention of this movement, and I definitely wasn't aware of it, and I don't think you were much either. It's called the Health at Every Size movement, for HAES for short. So with this Health at Every Size movement, my initial thoughts are, okay, they're claiming that you could be healthy at every size, and that was generally my thoughts about it up until I really actually looked into it and tried to understand it a little bit more. So this movement is a little bit more popular with, let's say, dietitians and health practitioners who are looking to provide healthcare without a focus on weight. You may have some gut reactions as a listener being like, oh, that's either very strange or that's great. Either or, it seems to be a bit of a polarizing perspective where some people have very strong opinions about it, and it's not common where you're often in a situation where you're like, oh, I don't really care about it. I don't have an opinion either or. When I first heard about it, I'm like, okay, it probably has really good intentions, but I don't know if it actually provides good outcomes. Because my understanding of the situation was that it meant healthy at every size, meaning that you could be healthy at every size, which is kind of flipping my entire knowledge of, I guess, healthcare in general on its head. We do know that being in a bigger body, which is what we generally use in terms of describing people who are, and please be aware that we are going to use some sensitive topics and terms in this conversation. People who are overweight, we generally describe as people in bigger body, just from it's nicer. It doesn't have as much emotional value attached to it. Max, is that agreeing with you so far in terms of our recollection of history?
Absolutely. Yeah, it is. And I think for me, the knee-jerk reaction is when you hear a sentence like that is to go, no, that means everything about it must be dumb, and completely discredit everything. And that is the wrong reaction to have. It's fine for you to disagree with the statement overall, and I do disagree with the statement, as I think you would too, that the size of body you are does matter and does have influence upon your health outcomes overall. But just because the name of the movement or the way something is described, if some elements of it you disagree with, you shouldn't discredit the entire thing completely. And that's what I think is a really important learning curve, and was a good learning curve for us.
Absolutely. Without a doubt. I think you could apply that to so many topics, and I'd love to come back to that later on in terms of specific diet styles and pros and cons for each specific item, just in a very general conversation. But sticking back to the healthy at every size, you kind of go down a bit of a rabbit hole, and it's like, okay, let me explore exactly why I think that you can't be healthy at every single size, because I used to absolutely be of the position that, no, like you can be healthy. Like sumo wrestlers have much better blood biomarkers than like your typical person around the same BMI. But we need to factor in that sumo wrestlers tend to have a lot more total lean muscle mass. I guess all muscle mass is lean, but total muscle mass regardless of the situation. And we do know that muscle mass overall has a huge benefit to our overall health. It seems like it's I'm not entirely sure if it's I think absolutely it is a proxy measure for some other aspects to health, such as cardiovascular. Generally, people who are more muscular tend to have better cardiovascular health overall, with exception to some individuals who may use performance-enhancing drugs or substances. But overall, muscle itself is very positive. It really helps with insulin resistance and insulin sensitivity overall. Generally, if you ever get sick, you recover quicker. Overall, it seems like it's just a no-brainer. It's really indicative of how long and how well we will live. As far as I'm concerned, muscle mass full stop is absolutely amazing. But, and big but, like my big butt jiggling in the air at the moment, it doesn't account for a total mass of the body. So this is irregardless if it's fat tissue or if it's adipose or lean tissue, muscle mass, organs, bone, total mass on the body does lead to an increased risk of hypertension, high blood pressure. And as we know, high blood pressure, pretty nasty in terms of the effects on its total, total impacts on our health span and lifespan overall. It's pretty much not up for debate anymore. I think I used to be a bit head in the sand of, it doesn't really matter that much, but it matters a lot in terms of how overall on a population basis, how we, let's say, deal with certain factors such as cardiovascular disease as a population. Max, what do you think about hypertension and its impact on populations?
Yeah, look, it's massive. I think the really good thing you were talking about then was about muscles. Not muscle. I guess muscle as a organ tissue, not muscle is in the. For some reason, I thought of the food. I don't know why. Yeah, skeletal muscle is the protective elements it has on your health. You were talking about the blood glucose, cardioprotective. There's a whole bunch of elements, protective against, falls on your joints, all that sort of stuff is good. It's protective overall for your health, and something that we look for in as people age. We prefer higher levels of muscle mass as people age because that does indicate better health outcomes overall and living not only a longer life, but is it lifespan or what's the word where it's not about just living long, it's about living high quality of life as well?
Really great question, Max. Absolutely great question. So I really want to kind of dig down on this and really solidify in our viewers and listeners' minds the difference between health span and lifespan. Yeah. So lifespan is the amount of total years we can live. Most people have pretty good lifespans in fully developed nations. Like they're pretty good. You're looking at least like an 80-year average lifespan per person. Doesn't necessarily mean we have a good health span. So the reality of some situations is that once we get to like a 65 age bracket, our health dramatically deteriorates, whether we have type 2 diabetes or cardiovascular disease or vascular disease in general or osteoarthritis that limits us from mobility or potentially osteopenia or a reduction in total muscle mass and function ability as we move forward. Our health and capacity as people I don't think it's stayed as high as I would have liked. And that's what I really like to focus on with my client consultations, that we're looking at improving health span, how long we are able to continue and care for ourselves, how long we're able to continue and be in bed, without lack of a better term, be healthy. So the difference between, again, health span and lifespan. Lifespan, total years we are alive. Health span, total years we are able to care for ourselves, be healthy, and be without permanent disease that disables us.
It'd be interesting looking at seeing, because we've got very clear data around lifespan and how it's improved over the decades. Now, I know health span's a lot more ambiguous and grey in the sense that depends how you define it and who's doing the testing, etc. But it would be good to look at some data around whether health span has increased alongside lifespan or whether it's potentially plateaued recently, or have you ever read anything about that, Matt?
That would be extremely interesting to me. I'm personally not familiar with much data at all related to health span because exactly like you mentioned, how do you measure something like that? How do you measure quality of life? Do you go up to people and ask, hey, how good are you living right now? Do you think you're okay? And that's a very subjective thing to measure. How do you compare yourself to someone who doesn't really care about their health and they just care about how they're feeling? Like, yeah, I feel absolutely great. But we know that they're from their kidney markers, like it's only a few years until they kick the bucket. Like it's very much a situation of you can feel totally fine without being okay. and trying to establish, okay, well, how will we determine those parameters? Is there like a scale we can use? I'm not familiar with the data, and I think it would be a very, very tricky thing to measure. I think you could go back and look at the data, especially through hospitals and trends over time, but it'll be a very big effort to determine. In terms of my general gut feeling is that I don't think health span has increased at the rate that lifespan has. So lifespan, we're living longer, but I'm noticing that people end up in these nursing home situations and they're often dependent on others to do some, let's say, daily functions. I can almost guarantee that majority of people our age can't do 20 push-ups, let alone someone who is 60. And that kind of worries me because, okay, we've already starting from a point where we're relatively inactive as a population. And then we haven't built up our muscle stores, haven't built up our bone density and bone stores in general. And as we age past a certain age kind of bracket, it starts to increase in the rate of depletion. And this is a bit worrying to me. I really trying to get this across to my clients. Like, we only have a certain amount of time in our life to really build up a bank. It's like if you were to see your health as an investment, which I often kind of relate to. The earlier you start, the more you will get in return later down the line. It's cheeky fly.
This is two podcasts in a row.
Yeah, absolutely. It just likes you a lot.
Yeah.
It's one of those things where I think we're going to see a slow uptick a little bit in health span, but I'm not entirely sure. I think it's one of those things that I'm yet to see data to have concrete answers on. But what I do know is that I'm very confident in that lifespan is dramatically increasing while health span is staying relatively consistent.
Yeah. Yeah. And I guess just going back, so reverting back to what we were originally talking about, which was the higher levels of muscle mass indicate really well overall that your health span is going to be significantly increased. And
not only health span, but lifespan.
As well. Yeah, exactly. Yeah. Not only are you going to live longer, but it's going to be independent life, that's not going to be spending all your time in hospital. And so I really like where you went with that, in that the muscle is very protective overall. And when we look at our big ticket items for what are the largest causes of death, obviously heart issues, which, the muscle helps, cancer, doesn't do much for that one. But then, you got your big ones like your, diabetes and kidney function and that aspect of things, which relates very much so to the muscle mass.
I would argue against the cancer one. I think muscle does a lot for cancer because you have to exercise to, of course, get the muscle, and exercise, we know, does a lot.
Sure. Yeah. Cool. So overall, it's ticking a lot of boxes, right? And I really like where you went with that, in the sense that having high levels of muscle mass result in you, by proxy, reducing your risk of a lot of these disease states. And then there is that negative, just like you were saying before, and that it is to a limit. It's not forever. And one of the big ticket items, which is what you asked me about, which was the hypertension and high blood pressure and how that impacts your health overall. And it does really significantly impact your health overall for basically everything. Having high blood pressure affects so many aspects of your health, and it's super important to keep track of. And medication goes a long way. But yeah, as you were saying, the number one thing, if you got someone who has high blood pressure, who has a lot of excess adiposity, one of the best ways to reduce that blood pressure is going to be to start to lose some body fat.
Yeah. And not just body fat. I think it would be, let's assume that they're just a very big person in general. The muscle also adds to the total resistance that our heart has to pump through. So for people who aren't aware, the reason why we have blood pressure is, of course, we need to pump blood throughout the body. It needs to have a certain amount of pressure to get down to our toes and all the way back up, so it can kind of flow around everywhere. The more tissue that we have and the more little spaces that it needs to go, especially adipose tissue, which has a very large impact. Adipose tissue can often act as like almost like a restrictor, in the sense that it can kind of put pressure on certain smaller areas that don't normally get a lot of blood flow. And doing that, we inherently have to increase our blood pressure. This is a very subconscious thing. You can't actually do it. You can't sit there and be like, I'm increasing my blood pressure now. Your heart increases the blood pressure as a response because, of course, those tissues still need blood flow. We need to get nutrients. We need to get oxygen to those tissues. Your heart's just doing its job to keep everything alive and running. If we have a higher level of total adiposity, it's fairly, I would say, indicative of a higher rates of hypertension and high blood pressure. And as we know, primary impacts on overall health, I would probably say the top two would be cardiovascular health, including neurovascular. So our risk of heart attack, stroke, major adverse cardiac events, or MACE. And I think something that a lot of people don't necessarily talk about is our kidney health. So kidneys regulate blood pressure a fair bit as well via our ability to excrete and reabsorb sodium, which I think a lot of people don't necessarily realize, and electrolytes in general. If our kidneys start to decrease in function because we have high blood pressure, our blood pressure can often go out of whack even more. And it's almost like it's a continually compounding loop where high blood pressure equals kidney dysfunction. Kidney dysfunction may equal high blood pressure in certain scenarios, and it continues on rolling and rolling and rolling up until the point where we eventually have some kind of major adverse cardiac event. And we're kind of seeing that in the literature. Even small reductions in salt, or literally a simple change from sodium chloride to potassium chloride, if you don't have a kidney condition, just for reference, can have huge impacts in terms of total population's length of life up to a few years, which I think is amazing in terms of reducing total major adverse cardiac events. Just a quick ad break. We're now currently taking clients by the link in the description or via our website. Back to it.
Yeah, for sure. And one of the big ones that we're going to need to discuss, Matthew, is sodium. And around blood pressure, we won't be talking about it today because it's a bit of a can of worms, and discussing its effects on blood pressure overall, whether it's chronic effects, so it's long-term, or if it's acute, so it's short-term effects. And
yeah,
it's a bit of a rabbit hole, and I think there's a lot of misconceptions around sodium, and I think a lot of people are very scared of sodium, and maybe rightly so, maybe rightly not.
Yeah, I've been doing a little bit of research on that one, Max. I'd love to have a conversation with you. I think that might be in the next one.
Yeah, awesome.
Stay tuned. Follow. That sounds great. Yeah, absolutely. Okay, well, circle it back.
I think we've danced around the question enough at this point. I think let's not be scared. Let's really jump into it. What are our real opinions on weight inclusivity versus exclusivity? Because I know I definitely have a strong, 30-second spiel, 1 minute spiel. What are your thoughts on it, Matt? Just digging right in.
Yeah. So let's define weight inclusive versus weight centric. So for the listeners at home, this is probably a very foreign concept. Weight centric approach is kind of imagine your very traditional, generic, very old doctor. Okay, hop on the scales. You either lose weight or gain weight or stay the same weight. The weight scales tend to mean a lot to the doctor. It can paint a picture, absolutely, but it often doesn't paint the entire picture. We're missing out. It's like it's more of like a blurry Polaroid versus a state-of-the-art video from your latest phone. A weight inclusive approach is when you're measuring all the things that aren't weight. So this is very important for people who are quite sensitive to the topic of weight, quite sensitive to the topic of weight loss in general, which is a lot of people. Like I would say that a good majority of people, whether you acknowledge it or not, tend to be quite conscious that the term weight and the term fatness, I guess, has a lot of emotional value to it. Not necessarily always in a very positive manner either. And then using a weight inclusive approach where we don't focus on a number, don't hyperfixate on something that may not actually represent some amazing in terms of amazing health outcomes, can be often quite liberating and better for us overall from a mental health capacity. And we all acknowledge how important mental health is after the recent stint during the big vid over a couple of years. So to summarize that one, weight centric, you're measuring people. Weight inclusive, you're talking about how you're feeling, your exercise, your clothes, your energy levels, your sleep, how you're feeling in your body, other metrics, not specifically stepping on scales.
Cool. Yeah, I'm really glad you defined that before we get into what our opinions are, because it really matters and clears up the air in case there was any confusion around that. Tell me, give me a quick little spiel around what you think overall. What's your summary around this particular topic?
Yeah, okay. Summary for quick spiel. I'll have to do a little bit of a tangent and then do a quick summary.
Let's go.
So, okay.
Done.
Initial thoughts with healthy at every size. I thought it was literally healthy at every size, meaning that everyone can be healthy at different body compositions. We now know, and we've always pretty much known, that higher body total adiposity, higher total body mass, generally not amazing for total health outcomes. pretty much indisputable at this point. I think if anybody's telling you can be healthy at every single size and body weight, I think they're probably going to be very biased in terms of certain literature. You can be as unhealthy when you're too low in your weight as unhealthy as if you're too high in your weight. It's just a different terms of health, and there's different, let's say, different conditions that come along with the weight. Looking through health at every size, it's a movement that specifically utilizes a weight-inclusive approach, which can promote the ability for really amazing health interventions without focusing on a number, and I love it. I thought I would never say those kind of things. I thought that, it's stupid. Why wouldn't you just measure the person? And then actually talking to people, getting to know what their story is, getting to know what emotions they have towards a stupid piece of plastic that tells them a number. It really is something that I think a lot of health practitioners should really be more looking into, especially dietitians, and being aware that the number doesn't mean everything. If you're focusing on just a number, I can just stop drinking for about 4 hours and I'm going to lose a lot of weight. Like, let's be real. It's just a metric. And if we're just using weight, we're doing a bad job. We need to be focusing on health as a whole, multiple different aspects of health, rather than just a number. Because realistically, and I can speak for a very general population, when people come to you for weight loss, they're not coming to you because they want to lose water weight or they want to lose muscle mass. They're coming to you because they want to reduce their total adiposity, which is perfectly fine. There's nothing wrong with wanting to reduce your adiposity for health. But I think there's certain ways you can do it which can improve your situation. So, to summarize my position on healthy at every size, I think it's a very useful tool. I think majority of health practitioners don't utilize it enough. And I think it's really an amazing thing that we can use to support our communities without having to alienate them through stepping on scales and potentially cause them to be even worse emotionally off before they stepped foot into your room.
Love it.
Max,
yeah.
What do you think about that situation?
I really like what you said there about the element of you're missing out on something, right? If you have a weight-centric approach, you are missing out on a lot of big key factors. And that's where I take issue with both sides. And this is why I really strongly sit directly in the middle of these two, because I think, in my opinion, they're both missing the point in the sense that, of course, there's going to be some clients who a weight-inclusive approach is going to be the way to go. They've got issues, psychological issues, and it's not a bad thing. It's just calling a spade, psychological issues around weight, and that's absolutely fine. Super common, and so that you don't want to talk about that anymore, and that's fine, and that's off the cards from discussing that. And I think that's perfectly fine, and you can go into a weight-inclusive approach and never discuss that. That's absolutely fine. If a client said to me, hey, I never want to discuss my height because he was really short, we don't need to discuss your height. That's fine. That can be off the cards. So same with weight, same with any metric. You don't need to discuss your hair color or whatever it is. But I think, again, why I sit strongly in the middle is because both sides are missing out on something. If you're weight inclusive, you're literally missing out on the weight data, and that tells you something. It doesn't tell you much, but it does tell you something. It gives you some indication of things. And same as, I'm pretty sure a weight inclusive approach wouldn't do things like measurements on the body, nothing like that. So
Absolutely
there's data you can get from that. There's data you can get from photos, from all the different aspects of what would be considered weight centric, which you're missing out on. And that's probably my issue with it all. I think both sides offer a good opportunity for people to grow. I think weight centric is probably a little bit dumber overall. And the reason for it being dumber, in my opinion, is because there's a whole lot of things above weight which are much more important for health outcomes overall, if we're talking about health in general, and almost even sports outcomes as well, if we're being brutally honest. So from a health outcomes point of view, in my opinion, stress is going to be pretty high up there. What you eat is going to be pretty high up there. How much exercise you're doing is going to be higher. How much sleep you're having, your quality of sleep you're having. There's going to be so many aspects that are going to be above weight, and then weight would come below all those things I listed and maybe more that I've missed. So the point would be for me, if you're weight centric, why are you focusing on something down low? What's the point of that? It'd be like if I just, where are priorities? Exactly. Yeah. It'd be like if we started a consult together and the first thing I opened up with was, when was the last time you had a chocolate Tim Tam? Like, okay. Is that all? Like, is that where we're going?
Yeah.
And like, just not like we're not. I shouldn't be prioritizing talking about Tim Tams with you. We should be talking about other things that are more important. And that's why I think the weight inclusive is just a little bit superior, because you're actually focusing on things that matter more. But I think, they're both. I'm strongly in the middle overall for both. That's my spiel.
I'd love to explore that, Max. So you mentioned a couple of things which I think are really interesting. So one of the bigger arguments against a weight-inclusive approach is sporting populations. However, one of the arguments for a weight-inclusive approach are sporting populations, with specifically people who have troubles with their weight management, more so, let's say, mental aspects and considerations we need to take into account. A lot of people in a sporting situation often have to do some element of food tracking. Relationship with food can often be not as amazing as we would like to expect. So you picture someone who's very athletic, very sporty, really fit looking, and then you kind of peel back some of the layers, and sometimes you actually find someone who really struggles with their food, hyperfixates on certain things, measures every single grain of rice, and then can't actually go a day without tracking something, without actually realizing that all of that doesn't really matter. Like, we're operating in grays and ballparks. We're not operating in very precision science like stoichiometry or some random aspects of chemistry, which is way above my pay grade. I'd love to know what your perspective on the use of weight-inclusive approach with sport performance is.
Yeah, I guess I just see it as, again, comes down to priorities, in my opinion. The same aspect of how I argued against using it for health outcomes, in the sense that I think it's low on the list of health outcomes for a priority of weight. And it will escalate depending on if someone's very, very overweight, then it will escalate above that. But for your average person, it's going to be very low down there on the list of priorities. And I think the same for your average sports person, in the sense that if I'm with someone comes to me wanting to get better at their given sport, obviously it's going to depend on this sport and the reason they've come to see me, but it's going to be very rare that we're going to be discussing weight to much extent at all. It will be a metric we can use to help us, just like we should be using all the tools in the tool shed to make us the best house possible, rather than only some. We will use that tool, but it will be the tool that's relevant, and when we actually need to use it, it won't be the only tool we use to build the house. So again, that's why I think it's just inferior, in that it's just one tool, and that's great. Or like, no, it's a few tools. You've got the weight scale, you got the scale, and wow, I don't know how to speak. You've got your body scales. Yep. You got measurements. You got photos. There's a bunch of different things that you can do.
Like a BIA analysis, like body scans, DEXAs, things like that.
Yeah, skin photos. Yeah, exactly. Yeah, so you got a bunch of those tools, which is great. But then you've also got a whole shed with lots and lots of tools that we can use, and that's why, again, I just think it's inferior to.
Yeah.
And look, we can go through specific examples. The reason why I've spoken in vague terms is because it depends so much on the sport. If you're talking to a soccer player versus a dancer or a bodybuilder or a pool player or golfer, it's going to be extremely different the way you're going to have that conversation with the person and what goals you're going to have. Potentially for a dancer, for someone who does ballet, weight may be more important, maybe more spoken about, because there's such a hyperfixation on ballet. I won't talk too much about more ballet because I know it's quite controversial.
Yeah, absolutely. Yeah, without a doubt. I think I'd like to highlight an aspect where I think weighing is potentially a little bit more prevalent, which I think not a lot of people would be aware of, is that endurance sport. So endurance sport, if we kind of imagine an endurance runner in our minds, they're very thin. They often use fat as a energy source a fair bit more than some of our other athletes, but they have a very low percentage of body fat on them, which is quite alarming. And then you kind of start to think about it for a second. Okay, they need to put out a certain amount of power per step, maintain a certain level of efficiency per step, and ensure that they're reaching the goal that they're aiming for. Adding on extra mass to accelerate and keep in motion is just going to hinder them. So falling within a certain parameter may be in their best interests. However, if you end up hyperfixating on weight and assuming that the lower means the better, you may end up going the opposite direction and then reducing total muscle mass. And I guess you could also apply the same to bodybuilding. So you could also be like, oh yeah, well, don't need to measure body weight for bodybuilding, you just measure the muscle size. And like, okay, well, you think about it for 2 seconds. If I go to gym and I work hard, I'm going to get a pump. That pump can vary in size a lot depending on the amount of electrolytes I've induced, depending on total water volume I have, depending on kind of if I'm more of a female biology, depending on the period time I have during the month. There's a lot of factors that go into play if you're just using measurements of single arm width. Doesn't really play into account. It's very hard to measure a single muscle or just a biceps or just a triceps, usually measuring entire circumferences. Averaging that out into weight tends to provide a little bit of an insight in terms of how you're going overall. If you're going through a massing phase, if you're looking to bulk up and you are gaining weight steadily, chances are you're probably gaining weight and a little bit of muscle at the same time. If you're looking to lose weight and cut down in terms of total adiposity and the scales aren't moving, well, chances are you're probably not losing weight. It might be counterintuitive for some situations, but it's can be a very useful tool in a very long-term oriented sport, a very consistent sport.
Yeah, without a doubt. And that's why, it has its place, without a doubt. And, that's why I think it can be a really good option for people to try and be more objective around their given sport or whatever it is they're doing, and maybe utilizing someone else outside of that as a coach or who is less, it's not you, right? So they're not as involved and they're less personal, so they can look at things more objectively, is going to be really important, because there is an optimal thing for you, or at least as close to it as possible, in the sense that if, as you were saying, with your endurance athletes, there is that optimal range of the percentage of body fat they need to have, the amount of muscle mass they need to have on their body, which is going to make them enable them to be able to perform the best. And outside of that is not ideal. And just like what you're saying before, in that if you got obsessed about getting too low of a body fat percentage, that's not going to be optimal, or too high, that's not going to be where you want. And that potentially could be option that I know that is an option for a lot of people, in the sense that if they feel like they're too much in their own head and they can't be objective themselves, they completely let go of it and they feel very free from that element, in the sense that they completely let go. Someone else takes the reins that I trust, and that's it. Like, I can just let them do it all, really.
Yeah, absolutely. I think on the other hand, if we were to go the complete opposite direction in terms of where weight doesn't really matter, things like shot put, weight doesn't matter in the slightest. I think you will probably have a better position if your total body mass was higher, just from the situation of, okay, I'm perpetually in almost a massing phase, which can often be better for total muscle growth and muscle strength. Or things like team sports. It's not a priority to be measuring your athletes on multiple times throughout the week, if that, even in monthly in those situations, because their goal is to work collaboratively as a team. And that's predominantly a psychological aspect. And then, of course, you need to be able to perform those movements very consistently, very, very, I guess consistently is the main word that I was using that scenario. Repetitively, again and again and again. Can you kick the ball absolutely straight every single time? Can you pass the ball every single time? Do you have adequate team dynamics to the point where you have a let's say a flowing environment that produces really good outcomes? Versus if someone's focused so much on their weight that it's like, okay, I weighed myself game day, and now, oh man, like I'm 300 grams down max, like my game is going to be off. It's completely out. As we know through personal experience, if you don't think you can do something, you cannot. There's absolutely no way. But if you're determined, like as soon as someone breaks the 500 kilogram deadlift, apparently everyone comes out of the woodworks and can break a 500 kilogram deadlift. It's one of the situations where if you set an artificial ceiling, you definitely can't break it. And that's the same applies to these kind of individuals. Hyperfixation on specific things. One thing goes wrong, you have 1 grain of rice out of your entire packet that's a little bit funky. Man, it's just a recipe for disaster. So I think nuance happens a lot, and it is required a lot. And determining how you would approach a situation and approach a client really depends on who they are as a person, what they like, what they respond to, and what their personality type is similar to.
Quick ad break, guys. Remember to click the first link in the description to check out our dietitian consultations and services. Back to it.
Yeah. I think it's interesting what I got from that on the team environment. Because look, I don't agree with everything you said, but I agree on the most part. And the things I disagree with are boring anyway, so we don't need to discuss them. But what I liked about the team environment thing you spoke about was that it comes down to priorities. In that the priority isn't to be weighing, like when you've got your team together, there's so many more important things that are outside of that, such as building up your skills, building up good relationships with all the teammates, which is going to improve them overall. And low on the list is the overall weight and all that. So once you've got everyone together, you don't want to be spending crucial time as a unit together weighing yourself. You want to be doing other things that are going to be getting you better results than weighing yourself. Like it's the same as progress for the sake of progress progress, just focusing on progress full stop is not the best way of looking at things, in the sense that you could do anything. As like when you're together, you could all go and sit in a circle and sing happy songs together, and you'd probably play better, right? Because you've bonded that little bit more. And then you'd be like, oh, well, that was effective because we actually got better. But then it's like, well, if you had have actually done something more worthwhile, such as doing drills or whatever it is, or doing something that's actually going to improve your skills and improve your team's output overall, study the game and look over footage or whatever it is, then you've gotten a lot better. So it's like, well, just getting a little bit better for the sake of getting a little bit better doesn't really justify much, when the whole thing should be, we want to be doing the best thing in our limited time available. I was going to ask you something, Matthew, but I've completely forgotten.
That's usually how my brain functions. I have a really great point, or like someone will say something mean to me, like, hey, Matt, your hair's extra curly today. And then I'm like, well, your hair's not curly, but I only think about that like 3 hours later, and it's usually too late. It's usually in the shower or something along those lines. In terms I was going to say this is probably a perfect time for Matthew and I were going to introduce a little segment.
Do you want to take it away, Matthew? Or me?
It's question of the week. Something that's interesting, exciting, a bit left field, completely out of the conversation topic, and just a bit of a question. Max, I haven't prepared for this in the slightest, and I've got no idea what's going on.
I have.
You're whipping up at the moment.
Should I do one?
Sure, absolutely.
Okay. I'll do something I've been thinking about recently. So these are just going to be completely random things, by the way. Matthew, I've got a question for you.
Yes, Max.
So I've been thinking about something I think that people can improve their lives. If you're looking to improve your life overall, feel happier in general, I reckon one of the keys to that is not caring what random people think about you. Just anyone that you don't know, really. What steps do you think you need to take to achieve that or get better at that skill of not caring? Because I think a lot of people do care. What steps should you take to improve that skill?
Get comfortable with the uncomfortable. I think the more you expose yourself to those situations where other people potentially have the opportunity to have thoughts for you, the more you realize that they're just people just like you, and their thoughts are just thoughts that don't really affect you. So it may be a bit strange. I would like to reference this to more of my networking experiences. So I used to be absolutely shit scared of any public speaking, to the point where I would be absolutely terrified. Like I would freeze up, clam up, sweaty hands, the whole lot. Going more into these events where I'm meeting complete strangers, never spoken to in my entire life, you really start to realize that they're just trying to get by. They're not out to slay some dragon. You're not there in their way or anything along those lines, unless they're rude to your face, and that's a different story, and then you can just slap them back in something. Most people are just trying to do the same as you, earn a living, support their family, support their friends, be a good member of community, and not rock the boat too much. It's usually, it sounds like I'm probably oversimplifying the scenario, but providing yourself the opportunity to be uncomfortable and continually exposing yourself to something that's challenging can often be quite rewarding, in the sense that you start to realize what actually matters in the scenario and what doesn't. You can start to focus a little bit more on the goals. So for example, in my goals of networking, I really need to find people who I can actively refer my clients to when they have problems. I need to find people who are financial advisors, who are psychologists, who are exercise physiologists, and I'm unable to provide those services myself. I need to be able to determine if this person is qualified at their job, if they're good at their job, but more importantly, I would say almost equally as importantly, is do they actually care about the client, or are they just doing it for money? Which I think is a huge problem. And I really need to have that conversation. I need to put my feelings aside and my emotions aside and really do my best Batman interpretation and be the best detective ever to determine, is this person appropriate for me to refer clients to? Can I trust that this person is able to provide an amazing service to what I would deem to be a quality similar to mine?
Yeah, that's the case. Do you think Batman's a good detective?
He's the best detective. He's literally the best detective in the world.
I never would have said Batman's a detective ever.
You're going to make some comic book fans really angry.
Really?
Yeah, it's like a whole thing.
But he doesn't do detective work.
Oh, you can't say that, Max. That's like as you entering like religious territory where this is a big no-no. This is a big no-no. Soon we'll start talking about wars which you have absolutely no part of, and then expressing opinions which to people that aren't listening. What are your thoughts on that topic, Max?
Oh, look, I actually don't know yet, and maybe I'll think about it, process it a bit more. But I'm really glad you gave it a solid response, and it was a nice little segment.
I completely guessed, by the way.
I should have put in little intro music, outro music for the for the segment. But yeah, no, look, I actually don't know, and thank you for answering. I'm really glad you answered, and I reckon let's finish off with one last thing about something nutrition related. Matthew, is there anything that's been on your mind from a nutrition perspective?
Yeah, I'd love to jump back just for 2 seconds to the healthy at every size, or health at every size, more importantly. So there's a big potential reasoning why you would go through a weight inclusive approach. One of them is that if the individual has, let's say, the topic of weight weighs on them, sorry for the pun, it weighs on them so much mentally that it causes so much upset that they are at risk of potentially doing something drastic and having a high risk of their life being a lot shorter. Then it seems to be of a priority that your priority is not fixing their weight. Your priority is fixing and addressing and supporting them through the process of dealing with those emotions related to weight. And at that point, I think you could almost absolutely throw the scales out the window, but you can almost throw any approach towards active weight loss out the window and really focus on positive, healthy things that you can do, not only physically, but mentally as well. If any of the listeners would like to learn more, a really great weight inclusive advocate is Fiona Sutherland. She's very passionate on the topic, and I would like you to go look her up and create an opinion for yourself. Do you think it's appropriate to be completely weight inclusive? Do you think it's appropriate to be completely weight centric? Or are you somewhere in between like Max and I?
Yeah.
To jump back onto, sorry, Max, please go on.
No, I think either end of the spectrum is wrong. That's my genuine thing. And that it's fine. I think it's fine in Fiona's case because she exclusively works with people who have those issues, like we were saying. And I don't want, again, I just thought about it. I don't want issues to be seen as a negative thing. It's like, Matthew has height issues. He's very, very self-conscious about his height. He has issues around his height. I have issues as well. Issues aren't necessarily a bad thing. It's just like the reality of that's what people have. And some people have issues around their weight, and that's perfectly fine. But yeah, so she solely deals with people with weight issues. So she can solely be weight inclusive, which is fine. But I think if you're just an everyday person and not like her, you can't be solely in one camp. I think that's too equally how the being solely in the weight centric camp is bad. I personally believe being solely in the weight inclusive camp is bad.
Well, that perfectly segues over into the next topic that I wanted to briefly discuss, and that is it okay to be in one camp of a dietary, let's say, dietary pattern, a diet culture? And this is very common. I did a post earlier today on specifically vegetarian versus carnivore. and how I see only in social media, and it's very much pushed by the algorithm because I'm pretty sure majority of people who are, let's say, balanced don't get views nearly as much. Everyone seems to be either keto or vegetarian or vegan or carnivore. There's no balance. There's absolutely no modulation. There's no acknowledgement of pros and cons. In carnivore's case, yeah, it can definitely and most absolutely be used for people who have very, very severe autoimmune conditions. And people do see some really positive changes, but there are consequences. Often our total cholesterol goes up. Often our LDL goes up. Our ApoB tends to go up. Generally not some amazing things that we're looking for cardiovascular health. In total, we're reducing our total fiber intake, which we know is very, very supportive of a reduction in bowel cancer. And bowel cancer tends to be the #1 cancer killer of people aged from 18 to, I think, 45 is the general demographic. And it's pretty alarming. And it's mostly preventable too, especially through dietary means, but absolutely early screening. In the same sense that you have to go vegan, you can't do anything else. Going vegan is almost, I would say, equivalent in terms of going carnivore, because you're exposed to so many nutritional deficiencies where your body can't function in an adequate and let's say optimal manner because you're just literally running out of key nutrients that you can't make yourself. So for people who are unaware, you can make some nutrients yourself in your body. Humans can't make certain nutrients in the body. So on average, B12 stores are generally in the liver, and vitamin B12 tends to run out around the 5-year mark for most individuals when you have no intake of any vitamin B12, which generally comes from animal products, specifically red meats. This can be a massive problem for total energy production, red blood cell count, our ability to shuttle oxygen around the body. Generally not a nice feeling when you're anemic at all. And I think there's pros and cons to every scenario, but being in one camp or the other seems to provide little benefit to the majority of the population who don't have a massive autoimmune condition or aren't severely susceptible to cholesterol and cardiovascular disease, or potentially epileptic, or is that the correct term? People who have epilepsy who do require keto diets for cessation, reduction of epilepsy episodes, which is a very real thing. That's the entire reason it came around. It's just a little bit of a topic of passion of mine where if you say, oh, this one diet is the thing that works for me, like every other single diet who's ever come up in more recent times, then what are we actually planning for? What is our goal here? Is it a goal for weight loss? I can just tell you to not eat for a few days, then problem solved. But if our goal is health, well, that's a very different story.
Yeah, for sure. 100%. And what I really like about that, and I'll touch on this again because I've been thinking about it a lot recently, is I might have even tell me if I've already spoken about this, but yeah, I have. Just the idea of health is you can, because I think people talk about cultural issues with health. So, for example, the Australian Dietary Guidelines is not culturally appropriate to certain food, certain people who eat certain types of food. So, if you eat African food, or if you eat food that wouldn't typically be eaten in Australia, then people will say, "Oh, look, it doesn't apply to me. It's not culturally sensitive enough." And it's like, well, that's not what the Australian Dietary Guidelines is. It's a very, very broad landscape of that you should aim for certain macronutrients, and of course, your cuisine has certain macronutrients in it. Every cuisine has carbs, protein, fats in it, maybe except for, is it Inuit? I don't even know. Is that an offensive term?
I've now that you mention it, I don't think it is, but it's one of those things where I'm so ignorant I wouldn't be aware if it is.
Yeah, neither. Yeah.
Apologies if it is.
people that live in the ice areas.
The ices.
People who live
in my freezer.
I feel like that's even worse. But I think they only eat like fish. I think they're basically like carnivore and they only have fat and protein. But besides those people, every other cuisine on the planet has a mixture of all 3 or all 4 macronutrients, depending on who you ask. And so it's like, well, no, the Australian Dietary Guidelines do a good job at representing your cuisine, and they give you good indications as to what percentages of each macronutrient you should eat over the course of the day. And yes, they do offer specific foods which aren't culturally sensitive to you. So they'll say, certain types of fruits or certain types of vegetables which you may not eat in your culture. But that's only when you start to zoom in. When you look out, then you look outwardly, it's going to be fine for anyone. Doesn't matter who you are or what you eat.
Yeah, absolutely. And they're guides. They're not
Yeah.
rules. You don't need to stick by them. And then if we were to say, this is the rule, every single person, this is the optimal diet, man, we'd be doing such a shit job, because everyone is very different in terms of the requirements. Everyone has a very different past medical family history. Everyone has very different priorities. Some people very much prefer to have a larger percentage of total body muscle on them, which is amazing. Absolutely go for it. Some people prefer to have much better cardiovascular performance because of XYZ reasons. It's all about determining what is important to you. What do you deem valuable? Do you deem healthspan valuable, lifespan valuable? Do you deem the next 5 years valuable to you above all else? It's very much up to you to determine these things. Also, on a side note, if you eat an animal alive, that will have carbohydrates in them because there's still glycogen in the muscles. Just thought that would be interesting.
Thanks so much for listening, everyone.
Thanks. Bye. Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and/or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.